In this video, we will be discussing the two-point discrimination test. The test determines the minimal distance at which the patient can distinguish whether 1 or 2 points are in contact with the skin. It is useful for measuring the innervation density of any surface area, not just the fingertips. Handheld two-point instruments are used for this test. A set of 2 plastic discs, each containing a series of metal rods spaced at varying intervals from 1 to 15 millimeters apart. A 20 and 25 millimeter spacing is also given. Any of the 2-pronged rods at the larger intervals can be used as the 1-point tester without rotating back to the single-pronged side of the disc. For the setup of this test, the subject should be seated comfortably with the hands laying with the palm up and supported. For the static two-point discrimination test, you will identify the digits and innervation zone to be tested and then occlude the patient's vision from the testing site. You will start at 5 millimeters distance between the 2 prongs. The prongs are held perpendicular to the long axis of the finger. The prongs are placed upon the skin only with sufficient pressure for a patient to determine what is being stimulated, not to cause pain. You will need enough pressure to the point of blanching the skin. The administrator will randomly alternate between 1 and 2 prongs in the testing site. The administrator will ask the subject to respond whenever a prong is felt and whether it is 1 or 2 points. Allow 3 to 4 seconds between applications. You will need 7 of 10 responses to be considered accurate. If there is no response or an inaccurate response, increase the distance by 1 millimeters until 7 of 10 responses are accurate. If 7 of 10 responses are correct, testing is stopped at 2 millimeters. Record the smallest distance measured in millimeters and repeat the procedure in additional digits as required. For the moving two-point discrimination test, identify the digits and innervation zone to be tested and then occlude the patient's vision from the testing site. Begin testing at 8 millimeters, moving longitudinally from proximal to distal in a linear fashion along the surface of the fingertip in the innervation zone. For testing moving two-point, the prongs are placed at the level of the distal interphalangeal joint and move slowly toward the tip of the finger. The prongs are placed exactly perpendicular to the long axis of the finger. The administrator will randomly alternate between 1 and 2 prongs. The administrator will ask the subject to respond whenever a prong is felt and whether it is 1 or 2 points. The patient must correctly identify the stimulus 7 out of 10 responses before proceeding to a smaller value. The test is repeated down to a separation of 2 millimeters. If there is no response or an inaccurate response, increase the distance by 1 millimeter until 7 out of 10 responses are accurate. Testing should be stopped at 15 millimeters. Record the smallest distance measured in millimeters and repeat the procedure in additional digits as required. The test is completed when the subject cannot distinguish moving 2 points at the distances. Now the demonstration will start at 5 millimeters for the static 2-point. So first we're going to start with the static 2-point discrimination test. So I have a discriminator here. There's prongs here that have 2 prongs, and then there's 1 prong. So what I'm going to do is I'm going to press this into your finger, and I want you to tell me if you feel 1 prong or 2 prongs. So first I'll show you. So here's an example of 2, and here's an example of 1. And so we will do this a couple of times, and I will have you close your eyes.
2, 1, 1, 1. 2, 1. 1, 2.
The subject was unable to identify 7 out of 10 responses correctly at 5 millimeters, but was able to identify 7 out of 10 responses correctly at 6 millimeters, and therefore would rate as fair sensation. Now you will see the demonstration of the moving two-point test starting at 8 millimeters. Okay, now we are going to do the moving two-point discrimination test. So I'm going to take the prongs again, and instead of pressing into the skin, I'm going to be pressing into the skin but moving. So it will be like this.
Okay.
And here is a 2. And you will do the same thing. You will just say either 1 or 2.
1, 2. 1, 1. 2, 1, 2, 1.
The subject was unable to identify 7 out of 10 responses correctly at 8 millimeters, but was able to identify 7 out of 10 responses correctly at 9 millimeters and therefore would rate as fair sensation. Here's the interpretation scale. The score consists of the smallest distance measured in millimeters. So for 2 millimeters to 5 millimeters, the sensation is normal. 6 millimeters to 10 millimeters rates as fair. 11 millimeters to 15 millimeters rates as poor. 1 point of perception is protective, and no point perceived would equal anesthesia. The study for inter-observer reliability accumulated 240 data points using 30 patients to test their index and small finger using 2 administrators. They used a Pearson correlation coefficient of p is less than 1 out of 10,000 times. In no instance was a difference of 3 millimeters recorded between 2 observers for any of the measurements. There was 1 millimeter or less difference in 93.4% of the moving 2-point test and 86.8% for the static 2-point test. Here are the data points plotted for inter-observer correlation of the static and moving 2-point test for the index finger. Data points represented by a number indicate the frequency with which this data point occurred. Here are the data points plotted for inter-observer correlation of the static and moving 2-point test for the small finger. Data points represented by a number indicate the frequency with which this data point occurred. Here are my references, and thank you for watching.